This is SG2 Perspectives, a conversation with SG2 experts and industry thought leaders about the biggest trends in healthcare and what we expect that's going to mean for the future of healthcare delivery.
When you think about digital health investments stemming from years back, there was a flood of money coming into the industry. People are running in a lot of different directions. Artificial intelligence is that next wave of easy money, tons of applications, tons of vendors trying to capitalize on the situation.
Welcome to SG2 Perspectives. I'm your host, Trevor Durin. Today, my colleague Andrew Rebhen's joining us. He leads our digital health research over most of this year, and it's going to continue. He's done a series of interviews with other digital health leaders, mostly from health systems across the industry, trying to get their perspective, pull it together on all things, crossing their desk, all things digital health strategy. And I wanted him to, one, share some of the best nuggets from those conversations, two, pull out any big key themes, how it may be shaping or changing his overall perspective on the digital health landscape. So Andrew, as always, thanks so much for joining us to share your perspective. Why did you think now was a great time to get some insights from the field and to do this Q&A series with people on the ground leading digital health strategy for health systems?
This series kicked off because of the craze around generative AI. The original intent was, let's start a series where we speak to folks about artificial intelligence, but that was a little limiting. And so I wanted to broaden the scope to ensure that we were talking about everything else that falls under the digital health banner. And what's nice about doing a Q&A series, much like how we can do on this podcast, is that you're able to spend a little time and not just focus on building a case study. It's also learning more about these leaders as far as their backgrounds, why they came to the organizations they work with, some of the other interests and hobbies that they may have. So it's more of an informal channel for me to get to learn more about what these digital health leaders do day to day, in addition to the actual interesting applications that they're using within their organizations.
It's got to be a wild role right now. What did you hear in terms of overall digital strategy? Is that pivoting or at an inflection point? I'm sure AI is having a big influence. What did you hear at the highest level?
One of the concepts that I got out of a conversation, this is with the chief digital and information officer out of Premier Health, was the concept of disciplined innovation. When you think about digital health investments stemming from years back, there was a flood of money coming into the industry. People are running in a lot of different directions. Artificial intelligence is that next wave of easy money, tons of applications, tons of vendors trying to capitalize on the situation. And you have to weigh opportunity with risk here, but also understanding you got to filter through the noise to understand the real opportunities that can be applied. Speaking to Mickey Clancy, we distinguished what's above the waterline as far as innovation efforts that we could be looking at, but also what's below the waterline as far as that IT operational backbone that keeps the lights on and supports all these innovation efforts that we're trying to prioritize. At Premier Health, they've been running a tight ship on this, understanding that they can't do everything. And in fact, the faster that they pull the plug on something that's not producing the value that they expect, the faster that they can shift those resources into something else. And having that kind of discipline, they've actually translated that into over $100 million in generated value over the last 2 years. There's a couple of lessons that they picked up on this. For one, they found that when it comes to digital innovation efforts, certainly you're going to have your tech leads who are involved in a lot of the implementations, but having operations staff that are leading a lot of the agile teams rather than technology staff, that tends to produce better pilot results and allows them to scale faster. And having a tight integration between IT and operations is often what ends up generating a lot of that value for them. But also, a similar conversation happened with Nebraska Medicine. So I spoke with Dr. Michael Ash there. He was the COO at the time. He's actually recently been promoted to CEO. So congrats to him on that. But one of the takeaways for him was when it comes to digital innovation, speed to execution matters. The way he phrased it, he had this clever way of phrasing it where he said it's the difference between using cannonballs and polishing cannonballs when it comes to strategy. For him, it's what are the actual problems that we're trying to address and how do we most efficiently go and tackle those? In other words, how do we use the cannonball versus spending too much time doing this needless incremental work, which would be polishing the cannonballs. So that those are some of the lessons that stood out to me as far as strategy.
Those are real good ones. Good, good metaphors in particular, I guess, in that role. You're often communicating and working with people who aren't as fluent and don't spend as much time on digital strategy. So that's helpful context. AI's got to be a huge piece of the puzzle. It must be top of mind. What do leaders have to say about it right now?
So there's two different perspectives on the AI topic. For one, I think a lot of the conversation around AI is still focused on how is our workforce building the appropriate skill sets and literacy around how to best understand what these tools are capable of. But also, as we start to creep more into using AI in the clinical domain, ensuring that we're doing it safely and responsibly. Actually, the first interview we did for this series was with a family physician. This is Dr. Eric Span out of Baxter Health. This was an individual I met, and he made an impression on me because, he's a classically trained doc. He's been practicing for 30 years. He's taken a proactive approach to trying to gain new education around what AI is and how he could best start to incorporate it. He actually went back to school essentially to learn more about data science. He's now enrolled in a PhD program to learn more about this. It was inspiring to me to see someone who's trying to build upon a strong clinical foundation to ensure that he can keep up with the technical advancements that we're seeing and maximizing the good that AI can really offer. There's a lot of discussion around how AI can bring about the emergence of new roles that are a hybrid. You may have seen terms like an algorithmic consultant. That was one that I saw in a recent article. Someone who's translating, maybe sits near or under someone like a CMIO or maybe a chief AI officer, but is able to translate how to best use technology to the front lines. And you always want to try to have someone like a clinical champion who can speak to a lot of the staff and workforce to try to pull people along in this journey. That was an interesting conversation. We did also actually speak to a chief AI officer. So this was Dr. Jordan Dale out of Houston Methodist. He's got a dual title. He's their CMIO and their inaugural chief AI officer. They're always testing out a lot of cool things over at Houston Methodist. Right now, they've been looking at how to use ambient scribes, not just in the outpatient setting, which most people have started in, but they're actually using it now in their inpatient and ED settings as well. They are using ambient support even in their operating rooms to try to understand how to best run an efficient OR space. What I got out of that conversation was how they're focusing on partnerships to move the needle for their AI strategy. And so they even have a community collaboration space where they bring in different vendors from across the local area to help try to collaborate on AI developments. But they look at partnerships as core to leveraging AI innovation. And as we continue to see AI models become more complex, larger in size, more demanding as far as investment, it's natural that a lot of the health systems that we speak to are still looking at their core vendors as the pathway to boosting their overall use and value out of AI.
Well, I like that idea of thinking about applications for scribes beyond just office visits, recent personal experiences in healthcare. I don't know about for you all, but for me, it always kind of solidifies some of the high level national stuff we're talking about. My wife had shoulder surgery, outpatient procedure, but still, afterwards, she's groggy from general anesthesia. The nurse and physician are giving us tons of discharge instructions. I'm feverishly writing them down. But then that night at home, my wife and I remember different things, right? Oh, I thought the doctor said this. I thought they said this sequence. I thought, even though they handed us something, what they told us was different than what they handed us. It'd be kind of helpful to just have a recording of what they said or a transcription of it. There's just so many easy opportunities for little pieces like that.
What's funny about the AI use case for me, given it's something I research so frequently and I've been advocating for it, is I was devastated earlier this year. I had my annual checkup with my primary care doc. In the clinic, they're advertising that they're using a bridge for ambient documentation, and he didn't use it during our visit. I asked him, I noticed you're not using the ambient scribe. And he went on a long tangent about basically not trusting the technology. In his words, he didn't want to be stuck in a position where when he's put on trial, that he says the wrong thing. That may be an extreme case, but it was interesting just to encounter the fact that this is a popular application, but not everyone's on board necessarily just yet. So it's going to take some work to ensure that the solutions are working appropriately, that they are safe, but also that you gain the trust of the frontline users.
Well, I'm sorry you had to break up with your primary care physician. That's tough. AI is definitely still the sexiest, flashiest thing in digital health. Virtual care is not, but it's still a growing piece. And I continue to hear systems incrementally changing, learning, solving how they're going to apply virtual visits. What did you hear?
The topic of virtual care super popular 2 years ago, and it started to quiet down a bit. And in fact, I did a webinar recently where I was talking telehealth, and I was being pretty blunt and saying it's kind of been a thorn in my side because I was a big advocate for it. And there's a lot of external factors that I think have slowed down the adoption of telehealth. There's still these bright spots and ways that we can fine tune how we continue to embed something like a hybrid care model in the future. One of the opportunities that we've seen form over the last 2 years is in virtual nursing. To learn more about that application, we did speak to Deb Roppers. She's the Enterprise Chief Nurse Executive out of the Guthrie Clinic. And we learned more about their virtual care center, which they call their Pulse Center, because they think of it kind of like the pulse of the organization, is what they said. So think of this as a command center like function. It's got several different roles involved. They have intensivists, they have virtual RNs for critical care and med surge, they have telemetry technicians, they have telesitters, they have a case manager nurse involved. The idea has been more or less established. You have your bedside staff. They're always tied up trying to take care of patients, but now you can offload a lot of the administrative functions to a team of virtual nurses that can help to decrease overall length of stay. They can ensure that you have faster discharges. You could decrease the number of hours in critical care beds because you've got these virtual clinicians that are facilitating patient care alongside bedside clinicians. It's simple as reducing tasks that, in this case, could take 30 minutes for having a two-person sign off on a document down to a 90-second process. So being able to shave those minutes collectively over the course of the day is leading to substantial efficiencies in this case. But they're also finding that virtual nursing programs are also helping in terms of recruitment and retention of staff. So they're able to keep staff who maybe don't want to work on the bedside. Maybe they're getting to the later stages of the career, or for whatever reason, they just physically can't do the job walking around, but they can certainly work in a virtual hub. And given that virtual nurses are often a bit more experienced, they do often serve as mentors for young new RNs that are coming in at the bedside. And so there's that workforce support angle to this. They also found in their case, by leveraging virtual nursing, they were able to substantially decrease the number of travel nurses that they were using. That translated into millions of dollars in savings for them.
That's such a positive story. That's great. Andrew, are you seeing any changes, bright spots, niches getting attention in terms of funding in the digital health landscape?
Yeah, so all this attention for digital health and investment going towards areas like AI and elsewhere. I did want to use this Q&A series as an opportunity to highlight some of the areas that maybe aren't getting as much attention. That came through in a conversation with Maria Toller, who's the founding and managing partner of Steel Sky Ventures. And what's interesting about that organization is that they invest in digitally enabled solutions, but they have a particular scope around applications for women's health and for underserved populations. They're looking to invest in digital health startups that, say, support women during menopause or other midlife health concerns. They support pediatric mental health care solutions. They're even investing in drone delivery for medical supply delivery to reduce maternal mortality in areas like Ghana, for example. Having a funding engine like that to support solutions that typically don't draw as big of a dollar as what you might see in other areas of healthcare. This is all about that equity play to ensure digital innovation is funneling through all the appropriate channels of healthcare. Add to that, we also had a conversation with Jerry Vucek, who's the Chief Information and Innovation Officer out of Children's Nebraska. He was talking to me about how, of all the digital innovation dollars coming into healthcare, only about 2% of it actually goes to pediatrics. And so you've got an overwhelming imbalance of where these funding dollars are going. Within his organization, they do tend to have a lot of support from grants and other philanthropic efforts, which is great. They've able to translate that into a number of efforts, whether it's their new Mammal Innovation Center or the fact that they are really proactive about crowdsourcing innovation ideas within their own staff. We were able to highlight across these conversations those areas of healthcare that deserve more attention and can also benefit from all the innovation that we're seeing in digital health.
These conversations aren't the only times you're getting to talk to leaders like this. You're talking to them all the time through normal membership engagement. What were some things that surprised you in these interviews or like a new trend that you hadn't anticipated?
So funny enough, one of the things that surprised me was that we had several conversations that were centered around Omaha, Nebraska and the Midwest, and looking at organizations that maybe aren't the first names that pop up when you start talking about emerging technologies and AI. And yet, whether we're talking to Nebraska Medicine or Children's Nebraska or Baxter Health or Premier Health, these organizations that are often serving primarily rural areas, and yet you have leaders that are being intentional about how they're exploring applications like artificial intelligence, virtual nursing. In the case of Children's Nebraska, they're exploring 3D imaging and using virtual reality for MRIs. They're even using holographic visits in care pods now. These are applications that perhaps you wouldn't expect in certain areas of the country. A lot of attention is always focused on the obvious names of health systems that are often leading the charge in innovation. So it was nice to be able to have these conversations, to look under the hood and realize how much these organizations are exploring with technology, how they're being intentional around their strategic approach to it, how they're thinking about funding in creative ways. And that's showing some bright spots for how we continue to think about digital transformation long term.
Yeah, for sure. The series has already been great. I know you have a few in the queue for the end of the year. Here's your opportunity to plug what's coming next.
Well, the idea is to continue to learn from different types of stakeholders, whether it's looking at a perspective from a chief strategy officer or a chief financial officer. We want to try to make sure that we're not just fixating on technologists for the sake of this conversation. And so we'll continue to look at those different angles and perspectives of digital health and ensuring that we get that kind of cross-specialist perspective here. Everyone's involved ultimately in how we support and sustain digital strategy. And so the broader the perspectives, the better.
Well said as usual. Thanks so much for sharing your perspective here. I love the way you approach research. Love the way you break these problems apart. And thanks so much for sharing your insights with our listeners and SG2 members.
Thanks, Trevor.
Thanks for listening. If you like this episode, please subscribe, rate, and review us, and/or follow us on Twitter and LinkedIn at SG2 Healthcare. And if you want to talk more about innovative healthcare strategies, you can always email me at sg2perspectives@sg2.com. Finally, SG2 is a Vizient company, and there are a bunch of Vizient podcasts that you might like. You could find them at Vizient /podcasts. Have a great day.